Picture this, you're having a great time with a new sexual partner. Everything is consensual and you both seem to be enjoying yourselves. But what if, after the encounter, you find out that you've contracted a sexually transmitted infection, or STI? Now suddenly, the pleasure and the excitement of the moment fades away and it's replaced by anxiety, fear, and uncertainty. This scenario is not uncommon, as STIs affect millions of people worldwide. So why aren't we talking about it more? Well, let's delve into the world of STIs and explore their impact on sexual health globally. So what are STIs? Well, the simplest way to define STIs are infections that are transmitted through sexual contact. There are more than 30 different types of bacteria, viruses, and parasites known to be transmitted through sexual contact, including vaginal, anal, and oral sex. Some STIs can also be transmitted from mother to child during pregnancy, childbirth, and breastfeeding. 8 out of the 30 pathogens are linked to the greatest incidence of STIs. Of these, 4 are currently curable, namely syphilis, gonorrhea, chlamydia, and trichomoniasis. The other 4 are incurable virus infections, namely hepatitis B, herpes simplex virus or HSV, human immunodeficiency virus or HIV, and human papillomavirus or HPV. In addition, outbreaks of new infections that can be acquired by sexual contact, such as monkeypox, Zika virus, and Ebola, have recently emerged and caused concerns worldwide. Now, let's talk about how big the problem really is. According to WHO, more than 1 million people acquires STIs every single day. Now, STIs can be asymptomatic or cause symptoms such as genital discharge, painful urination, and genital ulcers. Now, in 2020, there was an estimated 374 million new cases of chlamydia, gonorrhea, syphilis, and trichomoniasis worldwide. Now remember, these are the STIs that can actually be cured. But for the ones that can't be cured, the statistics are shocking. More than 490 million people were estimated to be living with genital herpes in 2016. More than 300 million women have HPV infection, which is the primary cause for cervical cancer, and it causes anal cancer among men who have sex with men. And an estimated 296 million people are living with chronic hepatitis B globally. Now that we know how big the problem is, we also need to talk about the consequences. And STIs can have serious consequences beyond the immediate impact of the infection itself. For example, STIs like herpes and gonorrhea and syphilis can increase your risk of HIV acquisition. Mother-to-child transmission of STIs can result in stillbirth, neonatal deaths, low birth weight, and prematurity. STIs like Hep B result in an estimated 820,000 deaths in 2019, mostly from cirrhosis, which is really fatty liver, and hepatocellular carcinoma, which is a type of lung cancer. STIs such as gonorrhea and chlamydia are major causes of pelvic inflammatory disease and infertility in women. So basically, if left untreated, STIs can cause severe health problems in both men and women. STIs can also lead to stigma, discrimination, and social isolation. Individuals with STIs hence may experience anxiety, depression, and relationship difficulties, which can affect their overall quality of life. Now let's talk about how STIs are diagnosed. STIs are often asymptomatic, which means you had the infection, but you're not showing any symptoms. Moreover, sometimes when symptoms occur, they can be non-specific. Hence, it's important that if you feel that you have put yourself at risk, you get tested. A healthcare professional can diagnose STIs in a sexual health clinic. They will ask you personal questions about your sex history, and it's important to be honest so that you can get the right help. They may take sample of fluid from vagina or your penis or a blood test to confirm the problem. It's the laboratory test that can show if any bacterial or viral STIs that may be present. Blood test can show if you have the disease that infects the blood, whilst urine sample may show if you have a bacteria in your urine from an STI. And lastly, let's talk about prevention, because it's always better than cure. The best and also the least popular form of prevention strategy is abstinence, or having no sex at all. The next best things are condoms. When used correctly and consistently, condoms offer one of the most effective methods of protection against STIs, including HIV. It's important to note that although highly effective, condoms do not offer protection for STIs that cause extragenital ulcers, for example, genital herpes. Nonetheless, the other strategy are vaccines. Safe and highly effective vaccines are available for 2 viral STIs, namely hepatitis B and human papillomavirus or HPV. Other preventative measures include practicing safe sex, getting testing regularly for STIs, and limiting the number of sexual partners. So to conclude today's episode, sexually transmitted infections are a significant global public health issue that affects individuals of all ages, genders, and sexual orientations. If left untreated, STIs can have a significant impact on sexual health, including physical, psychological, and social effects.
Thanks for tuning in, everyone. Please like and share this video and subscribe to our channel. Together, let's build a world where sex education is a human right.